has to do with the story in the last few years. And this is a question that came to me, which is about a need to talk about what happens with midwives and women who have suffered male domination in the societies which were colonized many years ago. I had an inspiration with Mamanda Negociatich, who built a thought about the danger of having a single story, just one story. She, Nuyayuda, thinks about the necessity to fly away and to resist in front of medical male-dominated structures in order to work in favor of women. This was a good inspiration to me because I am a midwife trained in a new training program in 2008 in Brazil. And from there, I've lived the different difficulties in the public health system in Brazil, because in the last 14 years, we have learned to resist to have a political identity in the country. I worked in a birth home in the last few years, and I will tell you more details about that. Can you see my presentation? I don't see my presentation. I don't know why.
Sí, te escuchamos.
Ah, no se ve la presentación. A ver, voy a intentar otra vez.
I'm going to try to share my presentation again.
Ahora sí. Bien.
Oh, yeah.
¿Ahora sí?
Perfecto, sí. Se ve muy bien.
Sí, sí.
Hay que poner en modo presentación. A ver las
sí, sí, claro. Ajá.
Presentation. Okay. What I want to share with you, and I'm coming back to my first slide because I thought you were seeing I was talking about Chimamanda Ngozi Adichie from Nigeria and the danger of a single or unique story, who inspired my the thought and the fight to speak about the history and story of the midwives. I want to say that I'm going to talk about, or I'm going to try to talk about decolonization and my reflection with the question of my PhD degree. Casa Angela Home, is a birth home in a poor neighborhood in Sao Paulo, which is a big city. You know, but Brazil is a very big country with a lot of social inequalities. And after many fights and struggles in the community, this house was created. This home is part of the public health system with the help of a German association. The name is Monte Azul. Casa Angela or Angela Home was created to gather different midwives to work together with the common objective, which was to build a birth home. Now there are no doctors in the Casa Angela, just midwives. And even having the laws to have this care model will still suffer from many different problems. It is very difficult to implement a place like this. It is part of the programs of health of the country, and we continue suffering the resistance of the doctors and the power structures in our country, which makes our work very difficult. This has to do with the feeling that I mentioned before, which is resistance. These are just general ideas about my research, which is a qualitative research with deep interviews that I used with people from the Amazonas community, from the areas close to the river, close to the cities, and also indigenous populations. I organized interviews with midwives also in the city of Sao Paulo, because it is the city where I live. Why these two groups of midwives, traditional and midwives and midwives in the city? Because they are both marginal groups. They suffer from political power. I worked with midwives in the Amazonas area, and we saw what happens in the indigenous communities. We know that many journalists and many indigenous people were killed, and this is an area which that suffers a lot of problems that come from the colonization process of the country, of Brazil as a country. My main objective, therefore, is to understand the practices of traditional midwives in Sao Paulo, where they work with the presence of doctors from a decolonialization perspective. My idea is to think about the concept of decolonization to help midwifery as a whole, a process surrounded by violence to the indigenous peoples. My idea is to learn how to understand resistance with a feminist perspective to help and assist women and to understand their needs.
Bueno, tuvimos una investigación muy grande.
We did a research to how to be born in Brazil, 2011, 2012. We also have some papers from 2010, and what we did was to compile data from the C-section rates. For example, the figures were high, up to 80% in private centers, up to 43% in the public centers. We've also had several cases of episiotomy, which can reach up to 50% of the births. And the biggest issue that we identify in different places in Brazil was the paradox of access and social differences. 32% of women that had complicated pregnancies receive assistance in centers without without a critical care unit, and 29.5% of healthy women without complications were treated in hospitals with this kind of units. So the result is that if you assess the rates of maternal mortality in Brazil, the epidemiological profile, according to the health ministry in Brazil, assessed in 2020, was assessing between 1996 and 2008, 38,919 women died due to obstetric causes. 67% of these were due to obstetric causes that could have been prevented. This mortality rate, maternal mortality rate, was reduced in 8.4 54% between 2017 and 18, and approximately 65% of the maternal mortality rate was found in Black women. What we've seen is that maternal mortality during the COVID-19 pandemic has gotten worse. There has been 22,685 cases of COVID and 2,035 deaths due to COVID, severe COVID in pregnant women or women that had just given birth. So 1 out of every 5 women dying of COVID didn't have access to the healthcare that they needed. There's also the obstetric violence. 1 out of every 4 women suffer some kind of violence, either physical or insults, classist, racist, or any kind of insult during the process. This decolonial way of thinking is a theoretical lens that allows us to understand the creation of the concept of racialization, as well as the Eurocentric view that encompasses male knowledge and Western knowledge. That is something that is still here in these countries that were part of the colonies, as it was the case of Brazil. Although colonialism doesn't exist anymore, the prevailing knowledge remains. And this is the dichotomy established between object and subject, where Europe is the subject and the former colonies are the object. The history of obstetrics as a science and to be produced by a specific group of white European men were always seen with a certain level of, how can we say it, contempt or disdain, the knowledge of the indigenous and African population in Brazil. The colonialization knowledge allows us to open a window to other points of view and political ideas in different areas of knowledge, including art, culture, religion, science, and it also establishes the need of a epistemic disobedience, which is this rebel gaze that allows us to learn to unlearn in order to learn anew. And this will help us to have other epistemic options. So what they were proposing was that this kind of disobedience, epistemic disobedience, is a rebel gaze. It will allow us to understand our theoretical and Eurocentric training, reviewing everything that we knew or thought we knew in the different areas where we build ourselves and our world, just as we're doing right now with obstetrics. Therefore, a decolonialized way of thinking, and here I would like to talk a little bit more about what has been mentioned. How can we understand these epistemologies that we knew that come from these big hegemonies, and how this dominance, this supremacy has been erasing the cultural and social knowledge that were not necessarily part of the Western foundation of knowledge. So when we're talking about the epistemologies of soul, which are basically something that has been suppressed by the dominant hierarchy in the modern times, including the obstetrics knowledge that we have, and ignoring and silencing the midwifery practices as you have experienced yourselves due to the colonialization process. So I'm going to give you some examples of the different interviews that I had with my traditional midwives and how I've been considering decolonialization based on their stories and anecdote of resistance working with other women. So I will start with Tabitha. She's 49 years old. She has 5 children. I was with her in March of 2022. This is one of her daughters. She wants to be a midwife as well. She lives in a community in the Amazonian forest, and she said some very strong statements, and I've chosen them to bring it to you. My objective is to make people aware of traditional midwives. It doesn't matter whether they are from Pará or the Amazonian. It's important to give them the value they deserve. Tabitha was the president of the Association of the Amazonian Midwives. And she believes, truly believes in this idea of a group, of a collective. There's not one midwife, there's all of them together. And for a while now, she's seen what we're doing. We are disappearing for a time now, and we need more visibility. We need people to see what we do. And this again expresses that desire of not silencing, of telling the stories from the epistemic origin. She also mentioned we can be part of the public healthcare system in Brazil. I cannot sign my name. I cannot write my name, but even I cannot do that. I have just as much practice as any healthcare professional. I have not been able to study, but I know what I do, and therefore I can be part of this system as well. What midwives do in the Amazonian, in many places, they're working for the public healthcare system in many ways, but they have not been considered professionals. They are not being considered as professionals by the government. They are not being recognized as someone who is offering healthcare, helping the general well-being of the community. And this is a strong statement by Tabitha. Another important element here to take into consideration, based on what she told me, she said, I'm going to leave the challenge to any president, to any doctor, or any specialist. If you can guarantee a woman can give birth in a whale ship or in a restroom or a kitchen in a factory because she was in pain, because she fell to the floor and she had no one else to call, because people usually are very used to working in hospitals where women are on specific spaces and it's easier. Will they also smile to the woman that is about to give birth, as we do, as midwives do, because she believes that knowledge does not need a hierarchy. She believes that knowledge and healthcare knowledge is it's considered higher up in the rank to what she knows because she's a traditional midwife. Here we have Sebastiana, another midwife. She's 67 years old. She is an indigenous woman from the Ticuna tribe. She has 11 children, and she lives in Misoes. She also tells us, my daughter-in-law has her first baby. She went to the fair, and she was about to have the baby, and I was in the fair, and nobody called me. The baby was born but was killed in the birth. I took my daughter, and she only knew that the baby was born because I told her, go, the baby's been born. Well, the time we got there, the baby was already there, and my daughter knew how to do things and was able to do it on her own. My daughter was able to do that because I taught her. My daughter-in-law didn't have that opportunity. Sebastiana was telling us about the knowledge that protect women from violence. In these specific cases, she was unable to help her daughter-in-law. She was unable to assist during the birth. And she felt that violence that because the hospital were not able to help her, the baby died. I also value a lot traditional midwives because they help us here In the hospital, they will only help us with injections or specific drugs to control contractions. What we give some tea, we do some massage, we help them with the pain in the legs and the back, and we do it with a lot of love. And sometimes they don't do that, and sometimes they don't even look at you. She's 67 years old, and although in March she had been not working for a while, she still is part of the community, fundamental part of the community, and resists in the midst of this violence. Female women suffer when they went to the hospital. The nearby hospital is in Tefe. There's this feeling of marginality that Clara Quilombo mentioned. This traditional obstetric, this traditional midwifery tends to talk about knowledge that is fighting against oppression, racism, patriarchy, and all these system of hierarchy of the healthcare knowledge. We need to pay attention to these women and what they know about resistance in order to learn, just as Tabitha said, and Sebastián also, because we need to learn about practices from a decolonial perspective to change this lack of equality in healthcare services with anti-racist, anti-patriarchy, and feminist practices that will help women to get what they need. This is part of the assessment that we have done when we were analyzing the different interviews. This is just a summary of all the things that I have planned to do based on this decolonial study of the interviews. And I'm going to finish here with a photo of the students of midwifery that are receiving their training here in Brazil. Sometimes the course that we offer that just was closed, but it's still a struggle, a fight in our collective in the last few years, trying to keep it open. And so thank you very much for this great opportunity. And that will be it. If you have questions, just let me know. Thank you, Bianca, for this incredible presentation. It's very important and admirable and so relevant that they can offer these kind of points of view. When you are teaching at university, it's impressive because you can open the mind of these students to all the knowledge, to the theory of midwifery, what's the roots of all these practices, from where it all started, where it all started. We have some questions already. So we're going. Can you please start with your question? You can do it both in English or in Spanish, whatever you feel more comfortable with. We're ready for you whenever you want.
Sorry, was it me that can ask the question now? I didn't hear the name.
Yes,
okay.
You can ask the question.
Okay, thank you. I'm sorry I can't ask it in Spanish. I understand a bit, but I'm not good enough to speak. Yeah, I have two questions actually. The first one is about the traditional midwives who you said are not kind of recognized by the healthcare system. So I was wondering, how does kind of payment or remuneration work in those kind of communities? And
no les pagan.
Would it be, yeah, how does
they don't
a
get paid.
midwife make a living and pay for her own home and her family? And then the other question is about the statistics. You showed that Black women in the public healthcare system in Brazil have a really high death rate. And I'm aware that this is also a big problem in the UK where I work, although I'm not a healthcare worker. But one of the issues to do with that in the UK seems to be a variety of factors, but one thing that Black women themselves say is that they're not listened to in hospitals or by healthcare staff. When they say that something feels wrong or they're in a lot of pain, it's often kind of dismissed. And even though then sometimes this is an indication of something really being wrong and needing medical attention, and that's perhaps one of the reasons why in the end they're more likely to die during this process of childbirth. And I was wondering whether you know what the reasons are specifically in Brazil, whether it's a similar kind of thing or if there have been studies into the factors of Black maternal mortality. Thank you.
¿Puedo hablar? ¿Sí?
Can I speak now? Can you hear me?
Bueno, lo que hace en Brasil es que voy a
In
contestar la
Brazil, I'm going to start with the first question here. So in Brazil, our traditional midwives, they've been doing some efforts to be recognized by the government as professionals that are part of the healthcare system as such. These women are part of this community and they are there. They can help pregnant women and everyone knows that they are there. But what ends up happening is that these midwives, they are like an intermediate step between the official healthcare service and women, pregnant women. So they are kind of in the middle. So we have our public healthcare system, which is called SUS, S-U-S. And throughout the pregnancy, these midwives offer massage, what we call a massage de bump in Brazilian. This helps women with pain. It helps placing the baby in a best position for birth. And they don't have to get, they don't get any money from the government because they are not considered as a part of the official team, if you like. So the government is not paying them anything for these services. And then you ask me, how do they survive? How do they make money, make a living? Well, this is an issue on female work, especially in countries that were colonies in the past. For years now, these jobs exist, but have not been recognized as such. These women that I met, that I talked to, have been working also protecting the nature, the Amazonian forest, the rain forest. Do you know the sayi? The sayi is a fruit that we have in the Amazonian. You can produce juice out of it and other things as well. And what they do is they work in the rainforest. They try to profit from what the rainforest offers them. So this is part of the problem, in fact. It's a structural problem and a social one as well in Brazil. And it shows that there's a lot of inequality among the population in the country. And the second question that you made was about maternal mortality in Black women specifically. There's more Black women that died giving birth in Brazil. And you asked me why. I think Paloma Terra, she's also from Brazil and she's around here somewhere. And she has included in the chat this article. A big name in the study of structural racism in the Brazilian healthcare system is Jurema Werneck. You can find it in the chat box. This is a very important author in Brazil about this topic. And it all has to do with the structural racism that we have in Brazil. This is an issue and it's very obvious in maternal health care, especially in countries that used to be colonies. Thank you very much, Paloma, for including that link to the article on the chat box. Because when we're talking about decolonializing healthcare, this is an opportunity in many ways for us to understand this structural racism and how we can change things in healthcare, and we can change the reality from there. Okay, that answered your question?
¿Alguna otra pregunta?
Is there any other question that you'd like to ask?
Lo que estamos viendo es un poco de lo que veníamos hablando previamente.
We see, and as what we mentioned before, with regards to traditional midwifery and many similarities with the Afro-Colombian midwifery that Yvonne mentioned before. And I think that these similarities are very interesting, and also the resistant fights, the fight for resistance in the health system.
Bueno, quizá solo decir, tuve muchas interrupciones.
I had a lot of interruptions, sorry, Bianca, with your presentation, but thank you, Bianca. You're a midwife, and what is your perspective with regards to traditional midwives? When they are within an institution, they can massage, they can accompany women, but they are not in the birth because doctors are there to assist and help them in the birth, and they are also volunteer. So I think that this gives power away from them. They takes power away from them because they are not in their context, and they work in a different place. Yeah, they are ready to work in a comfortable way. I know that because I've worked in northeast of Brazil in these houses, in these homes where they try to humanize the birth. But I'd like to know from your perspective if midwives should be in the healthcare institutions. Do you think that that's the place where they have to be to work there? And what is your perspective on that?
Sí. Bueno, voy a contar un poco
I'm going to speak about what midwives told me when I interviewed them. Many of them wanted to be with women, and also women wanted to be with midwives, according to my interviews. Sometimes they couldn't be in the hospital to accompany women. In Brazil, there is a law from the government which regulates the right of accompanying people, and the law is from 2005. But in many hospitals, we don't have the right to be present during birth. With regards to your question about if midwives should be working in the institution, I think that first we need to think about decolonization and the question about how to make this possible, how not to have a hierarchy of knowledge, so that midwives, doctors, nurses can work together in favor of women, but without a hierarchy. it's like a structural question of the society, this hierarchy of knowledge that also has to do with the Western midwifery present in the books where doctors study. I think that this also is a question that I know because I think that we need to change uh, the place where knowledge is created so that we can we can do what Boaventura says about the epistemology of the South. We need to learn with the peoples from the South. And I think that this is a challenge. What you mentioned is just a challenge. And I've thought a lot about that. I have a friend of mine here who is also a midwife. We work together and we've talked a lot about that. How midwives can do their work in favor of women, to support them, to understand their needs, because they know when a woman has to go to the hospital and they know when a woman doesn't need to go to the hospital. They protect women because they understand their needs in terms of health. So I don't know, it's a challenge to think whether midwives can be part of the institutions. I don't have the answer, but we need to respect midwives because midwives can work in hospital, but she needs to be valued, and she's not valued from a colonial perspective. We're just thinking about this challenge, but we don't have the answer. I feel that Brazil for Mexico has also been like the avant-garde, like a modern place, and we take some ideas, some things that happen in Brazil, especially with birth humanization. The design was to include midwives in the hospitals. And here we have some examples, and midwives are included in the public in the healthcare system. They are volunteer, and they also, I don't know, clean. They don't develop their real work, and I think that this is also replicated in some indigenous communities, but it hasn't worked because communities do not go to hospitals. And it is something that is leading to have more midwives in the institutions. Yeah, thank you. Okay, we're going to close this presentation, this session, to have a 15-minute break now. I thank you, Bianca, for sharing your experiences with us and this very important work that you are developing. I also want to thank you. And I also thank the translators because I could speak in Spanish. Thank you. And again, we invite you to come back in 15 minutes so that we can connect with the last presentation of the day. A big hug, Bianca. Bye-bye. Bye.